Hi everyone, it's Alicia. Welcome to the channel. So I wanted to give you guys a quick update on my surgery, my septoplasty. So we are 1 month now past the surgery. This was 1 month yesterday. And so at the 3-week mark, we went in and the surgeon went in and she went ahead and got all the packing out and all of that kind of stuff. Not very comfortable. They do numb you, of course, but having to get all that. It's like a gel that they use. I guess years ago they used to, pack with cotton type stuff or whatever. So the gel was in there, and of course I'm doing the rinsing. Right now I'm rinsing 3 times a day. Unfortunately, what she said was that I'm not quite recovering as quickly or as nicely as possible. So back on steroids again. This is probably, I think this is like the 4th time that I've been on steroids, unfortunately. But it is helping a lot. It's reducing the swelling. I think I sound better. I'm breathing better. So I think I have that through about another week yet to get through all of those. It's been a really rough recovery. Like in my last video, the very first week I had no breathing out of my nose at all. As the weeks progressed to the 3rd week, the first week horrible, 2nd week not great. Once the antibiotics and the prednisone was done, basically started to get worse, feeling like I had a sinus infection, just very, congested. So, and then after this 3rd week of her going in and kind of clearing all that out, everything's out now. The sutures were in the left side. She likes to suture on the left side. So those are all ones that just dissolve and they're gone now. So I'm back to using my Navage. I was using the little squeeze like Medi, I forget what it's called, Neil bottle or whatever it is. And so I was using that little squeeze bottle because I was too much with the Navage, but now I'm back to the Navage, which is kind of nice. It's a little bit quicker, a little bit easier to do. Also have me rinsing with a steroid. So there's a little tube, and it's called budesonide, and you just squeeze it in your water, and then, use your salt packet and everything like that. And you can use it with the little bottle or Navage or whatever it is that you're using. So that's kind of where we are right now. My surgeon is actually her baby's due in the beginning of January, so I need to go back middle of January. So most likely I'll see, one of her colleagues, and they're going to go in there and take a look and everything. So they go in and they take a look, around with the scope and do some pictures, and sometimes they do some videos and things like that. She did go in to get the packing out on the right side. The right side is more swollen for whatever reason. Everything's swollen, but that's the whole problem, is why I'm not recovering as nicely, is because everything's really, really swollen. But she did go in, and it kind of looked like, I want to say, it's almost like if you had like a tongue, and then on the end of that, it would be like a little, like thin, like grabber, and they went in and got the packing out, and that was very painful. Had a little bit of blood, but they were able to stop that right away, so there wasn't any issues or anything like that. So everything is basically back to normal as far as all the things that I can do. So there's no restrictions. I couldn't blow my nose, I couldn't lift anything, and all these other things that I couldn't do. I couldn't wear my CPAP. So all those things are lifted now after the 3rd week. Finally feeling better where I can wear my CPAP and things. Every day is, a little bit here, a little bit there. I'm just hoping that over time, she said it takes about 3 months. So in the next one that I go to see her, will almost be at 2 months, because I had it on 11/25, and I think that my appointment is like 1/17 or something. So we'll be almost there. It'll be about, 7 weeks. So I'm hoping once we get to there, it'll be a lot more improvement. So I'll keep you guys updated to see how it went. Even with the recovery being a little bit, longer, not as nice as other people recover, it's still I'm hoping that it's still really, really going to be helpful. And she said everything looked really, really good. One of the things I did learn by going to the ER after my surgery, I should say, is that I had scar tissue from what they gave me to stop the bleeding, but she was able to remove that. So all good there. I was really happy that she was able to do that. So I'm very pleased, with them. The surgeon seems awesome, and, they're very caring. They did call. My family doctor actually called to see how I did with my surgery, see if I needed anything, see how my ER visit went, and the hospitals usually call. So it's really nice to have, that follow-up. And she's always very nice about answering any questions. When you can send a message through their portal, you can call and things like that. So I've been pretty pleased, but I'm going to keep you guys updated on my journey. I do want to check in kind of around that 2-month and 3-month period to see how successful it really was and to see how well I feel or don't feel. I do appreciate you guys spending the time with me today and going on this journey with me. Don't forget to like and subscribe. Thanks.